Everyone, it's Kristen Willard with GAAPP, and thank you for joining us today for our GAAPP Academy. Before we get started, I want to remind you that whether you are speaking English or Spanish, you need to choose your language by clicking on the globe icon at the bottom of your screen. It's part of the Zoom platform, so you click on that globe icon and please pick either English or Spanish. We have those to offer you today. Thank you so much. I'm thrilled to bring to you an exciting agenda today. We welcome you to this last GAAPP Academy of 2024. I am going to be talking with Ruth Tal-Singer, who is our Chief Scientific Officer here at GAAPP. I have exciting things to share with you about her background, and then we will hear wonderful things from Dr. Tal-Singer about the research we conduct at GAAPP, as well as how you can work with us on different types of research projects. We'll talk through some real-world examples, as those often bring us, I think, the best lessons learned and the successes that we may not otherwise know. We'll also talk through tools and supports for our MOs, but also for your patients. So things that you can use to learn more, about research and to help your patients understand more about research as well. And then it's wonderful that I can tell you that we received dozens of questions for Dr. Tal-Singer, and I'll be asking her some of those at the close of our discussion. So welcome, Dr. Tal-Singer. We're so glad to have you here.
I'm really happy to be here. Hello, everyone.
Let me tell them a little bit about your background. So Dr. Tal-Singer, or Ruth, is a patient advocate and clinical research scientist with more than 30 years of research and development experience. She started her career in healthcare as a military nurse with a focus on critical care. She then obtained a doctorate in molecular virology at the University of Pennsylvania in the United States, and then spent almost 23 years in industry working on the development of medicines for infectious diseases and lung diseases. She's led many international collaborations that brought together industry, patient advocacy organizations, governments, and academic researchers. And she did this to improve the understanding of lung diseases as well as care delivery. Then in 2019, she joined the nonprofit sector first as president and CEO of the US-based COPD Foundation, and since 2023 as the chief scientific officer at GAAPP. And I have a lovely quote from Ruth that I would like to share with you before we begin our discussion. I think it'll tell you a little bit more about her. She says, as a researcher and a caregiver for family members with lung diseases, I see disease prevention and the development of better treatments as a life mission and a personal calling. So we thank you again for being here and for sharing this day with us.
Thank you, Kristen.
So let's get started. We have wonderful things to talk about and to learn from you today. So in this first slide that we have here, what do we know about our member organizations? Are they interested in research? What types of research, that sort of thing, excuse me.
That's a great question, Kristen. And one thing that we did before our summit in September was to run a survey within our member organizations to ask them, are you interested in research? And the majority of respondents said, yes, we're interested. And one thing that we learned, we asked a lot of questions, but one thing that was important that resonated with us is that 65% of member organizations, or as we call you, MOs, lack human subject research training and are very, very interested in participating in research and want to get the training. So this is why we're here today. On the right, we're describing our objectives for 2025 and beyond is to really make sure that we get funding and expert support for local projects, that we did record a podcast that we'll mention at the end with support tools and education on clinical research. And we also have a great advisory panel that's active in helping us with our research projects. So the whole idea in 2025 and beyond is to expand that.
Wonderful. I think that's a nice way to set the stage, learn a bit more about where we're starting. So I'm sure you are asked this question quite often. I am even asked this question quite often in education, and the list is very long. So, if you had to say what types of research projects that we're most often involved in, tell us more about that.
Sure. So the top two are the ones that we do the most, and that is recruiting for clinical trials by a variety of sponsors or pharmaceutical companies or device companies. Or anyone that wants to do a clinical trial, we help with a promotion and getting the information out that there is an available clinical trial, and we do that by disease. So we do recruit for trials. We also bring patient investigators that we'll talk a little bit about later. One thing that we spend a lot of our time on is conducting global surveys. So trying to bring the patient voice from wherever they are, not necessarily patients of experts, and bringing an international patient and caregiver and sometimes provider voice through surveys that are that we launch, we analyze, and we also report. We also conduct focus groups, and focus groups is bringing participants, either patients or caregivers, together and asking them questions to address a research question. That is a bit more labor intensive, and we are involved either in recruitment for focus groups or in implementing or doing the focus groups. Process improvement is, let's say somebody wants to improve the way patients in a clinic or in a hospital are taken care of. For example, pulmonary rehabilitation is something that's really important. If we want to improve the way patients are cared for locally, we can participate in that type of research to say, is it better than the previous method? So that's process improvement. We always contribute to publications of work that we participate in and bring the patient and caregiver perspective into publications. And one thing that Kristen is you're a big expert on is late-term summary, is making sure that we summarize the results of this research in a way that people can understand, that's not too technical, and it's not just for healthcare providers. I don't know, Kristen, if you wanted to say something about that.
Glad that you mentioned that because I think it was not too long ago that researchers started prioritizing the dissemination of research in language that all of us can understand, right? That those of us who are not involved in research can understand, which is, in my mind, not just important so we can learn what happened, but also so we can learn what we were a part of if we were a part of the research, right? It was done with us, so we should know about it. I think the other thing I love to see, and I'm really glad you included it here, was the fact that the translations are so important that we're not just putting it out and assuming that someone could do a Google Translate, let's say, or have a web page auto translated and understand the subtleties of language that you would have in research, in a research summary, right? Because it is so subtle and specific to certain things that we would say. So I really
Yeah,
love that you included this.
yeah, most publications, scientific publications, are in English because that's a common medical and scientific language. So really making sure that people understand it in their own language, how it impacts studies that were done in their country, how it impacts their own environment and their own medical care or nursing care.
I think that's important. I think the other thing that we have not discussed before, in preparation for this call, but we're seeing more and more that people are making sure that there's diversity too in the research that's being done, no matter what type of research it is, such as those represented here, right? You're seeing more and more of that.
Yeah, and I think that's a point around surveys, is that you can actually include people who do not live in big centers, who live in small towns or in villages. They may not have access to those big experts that normally recruit patients for trials and for research programs. So by doing surveys, yes, you need access to the internet, but at least you can be more inclusive and get a more of a diverse voice than the people who get the best care or those who get the see the experts.
Total points, and the way it should be. Okay, so this is, I think, an exciting part of our conversation today. What are the possible roles of these member organizations that are interested in participating in research. So what does that look like now that we know what types of research we have here at GAAPP? How do they become involved, and what does it look like in actuality?
Right. So it could be small involvement or really big involvement. Some of our organizations our member organizations are quite experienced. They have their own research teams and are very, very good at working in research, and they could participate in co-developing the project with us, applying for funding for projects and being direct partners in developing the project. But it is important to also have organizations who wish to contribute and offer opinion and perspectives to inform how we design the studies. But another part of it, and another part around developing project and sharing their perspective by recruiting patients in their area, is to disseminate the information, either the fact, hey, there's a study that is interested in patients in our country or in our region, please participate. Or once we get the results, is to educate patients, providers in the country or in the region of the results of the research and communicate it. So dissemination is a component. It could be all the way from when we launch a survey or a study to at the end reporting and sharing and disseminating the information, because otherwise we're not making any impact.
So let me ask a question. I know you said you don't have to be, experienced or a large organization, that type of thing. If I am an organization of two of us working at my kitchen table, as we often say, can I contribute to research?
Yes, absolutely. So one is if you have a Facebook page, or if you have a WhatsApp, or if you have any way to communicate with your community locally in your language, you can
Hmm.
do something about it. But you can also offer your opinion and say, let me review the questions. And does that resonate in my country? Does that resonate in my area? So you can contribute as much as you wish to contribute. I mean, there are some things that are more complicated, but when it comes to being a part of what we're doing here at GAAPP, the more voices we bring into the table and the more diversity, which is what you mentioned, is important, is better.
And actually, I'm thinking too, it might help us to have those organizations even more sometimes because we're not hearing from their communities. If they're two people and the only people representing their groups, right? It adds that perspective. As you said, brings even more diversity to the conversation, which is important, as we know.
Yeah, and especially in rare diseases, rare conditions, you're not going to have hundreds of
Right.
people involved. You still need to bring that voice of that individual and think, how can I represent the community of individuals with rare condition?
So it's sort of bottom line then that there is a place for everyone. You don't
Yes.
have to have a degree in medicine or research, design, and implementation in some way to do any of this. And the other thing I think too is that people cannot see always from the outside that the support exists inside GAAPP, the expertise exists inside GAAPP to sort of help along the way or to be the manager of a project, right?
Yes. Yes.
Okay, so I think that helps it to be less daunting because research can be daunting for people who don't live inside it. All right. So let us talk through this next one. I think first, where can member organizations learn more about the opportunities and also, how does the all this research that we were just talking about and the different types of research, how does it align with what we know to be the needs and interests of our MOs? How are we making sure that happens?
So that's really important. That's something that we added over the last couple of years is we have a research pillar on the GAAPP website. So please visit it. We do update it quite often. It talks about our mission of research, our vision, how we want to help bring everybody together as partners in research. It does talk about research opportunities, and there is a recruitment area on the webpage. And if we're recruiting for advisory panels or for surveys, it will be posted there, and it's posted by disease area, because obviously GAAPP works on a lot of different conditions. So we put a lot of effort into it. Also, if member organizations have a question, please use this email address rather than email me or Kristen or Gretchen. Please email us at research@gaapp.org, because we can, if you have specific questions about a project, then we might be able to help address the question if something's not clear.
And there are no questions that are too small, I think is also helpful. Again, don't be intimidated because this is a process for everyone. That's great. And I love that there is this centralized location for research opportunities. I think that will be helpful to people too. I know that is something new for this year. So if people haven't seen it, I hope that you'll check that out on our website.
And there's great education material that was launched on research in COPD. There's a tab there. It also talks about patient-reported outcomes and tools that you can use in research and also in patient care. So a lot of the work that we're doing, we are updating our research web pages.
Yeah, I can vouch for that. They're updated regularly to keep everything fresh and make sure that they are current opportunities. Do you mind, because you just mentioned that patient-reported outcomes, do you mind just telling us what that is? Because people may hear that and not really understand what it means.
So patient-reported outcomes are the ones that are reported by patients. So we basically have questionnaires. The example is the asthma control test or the chronic airways assessment test that used to be known as the COPD assessment test. So these are validated questionnaires that you can use to track how you feel, what symptoms you have, and this could be shared with the clinician that you're seeing. So that a patient-reported outcome is essentially something that gives us information about how the patient feels or functions. So it's usually questionnaires that the patients are filling out, either by us asking them, some of the longer ones, or by them filling it out themselves, getting a score, taking it to their clinician.
So gone are the older ways, not entirely, but gone are the old ways of someone just observing you and sort of saying how you feel or what's important to you or how your day looked to them, right?
Yeah. Yeah, and
It's about,
sometimes you're not comfortable talking about something, or if you have 5 minutes, 10 minutes to see a doctor, you want to have some sort of a summary that says, I'm breathless. Just goes through the list, because you could be nervous. You may not have a lot of time. And so having a way, I think we mentioned in our vision, harmonize, we have the same way. So clinicians know that this is asked the same way for everybody. It's validated in the questions, the languages that it's being asked, and to make sure that we know how you feel. Can you climb stairs? Can you exercise? Are you coughing? Is your chest tight? So it's really types of questionnaires that tell you how a person is doing. And it's done in a standard way, which is really important in research, is to make sure that we don't ask the question differently every time.
I think that'll be very helpful because that is a term we hear a lot, and I'm not sure that we all know exactly what that means. So it's great in this context. Thank you for giving us that information. Okay, so I love examples. I love real world examples. Can you talk us through this example and the involvement of MOs and where it started, how it progressed, and where it is now?
Thank you. So this is really an exciting project because we learned so much about it, about how patients feel and what they think by doing the survey. So we submitted a proposal to GSK to study asthma and chronic rhinosinusitis with nasal polyps. And we wrote the protocol, designed the study, the survey. It was completely anonymous. It was translated, I believe, into six languages.
Seven. Yeah.
I don't remember, but basically
Right
we had a
around
lot.
there.
Yeah, we had a lot of translations, including many countries. We submitted it to ethics. That's something that's really important in research. You can't ask anybody questions unless you get their consent to use their data in research. So GAAPP did all that. We did ask member organizations to help us promote or recruit for the survey. And we compensated our member organizations by doing the recruitment. I'm not going to list all the organizations, but you could see that we had a lot of countries. We didn't have a member organization in Japan. It was included in the study, but we have Canada, US, Spain, Italy, and France involved in this survey. We got amazing results. We got so much information, either in text, free text, or in responses to questions. So we're still reporting a lot of the results. We have an accepted abstract to one conference. We're submitted other abstracts. Our member organizations that participated in recruitment reviewed and edited the content to make sure that it reflected the results of the survey, and we submitted a manuscript for publication. This is the first manuscript for the scientific community, for the research community. It's in English, but you could see that once this is published, we can disseminate a lot of the information through education and translation of the content in the countries that it was done. So we did communicate it to a lot of people in different countries. So I thought that was a really, really good example of success.
Well, example of success. And I was lucky enough to be part of this project too. I can sort of vouch for everything that Ruth is saying, I think, and the inclusion of the member organizations in every part of this. Really, it isn't something that member organizations are involved in as sort of a token of what we do by any means. It's we want people to be involved and drive this work and give us feedback and help us to find, people in their community to be a part of this so that they're reflected in the outcomes of the research, et cetera. So I think this is a really nice example of what we're trying to do with so many of our projects. Do you
Yeah,
mind
and
going back to, oh, go ahead, Ruth.
sorry. No, one thing that I wanted to mention, one thing is around this free text. So I mentioned before around diversity and inclusion, and that sometimes we think we know what patients feel and think, but we got some
Right.
answers from mental health, for example. We didn't ask that question, but we got it in free text. And so we learned a lot about it. And then as a result of that, we developed a different survey on mental health and started asking those questions around sex, for example, that usually you don't include in surveys, but we did start asking it because
Mm-hmm.
patients are impacted in their personal lives, but they're not necessarily always comfortable talking about it. So this is how we learn.
So perfectly said. Um, and I wanted to step back a second because the ethics conversation, can we talk more about that and what that means? What ethics is, why it's important?
Yeah, I don't think we have a lot of time to go through that. We do have a podcast about the importance
Mhm.
of clearing. If you're asking a person a question, you can ask them a question. If you're going to use it in research, integrate it with data from other people, publish it, communicate it, even if it's anonymous, you have to
Mhm.
make sure that it gets reviewed. There is the Declaration of Helsinki. Some people are aware of that. But human subject research is regulated by law around the world. In Europe, GDPR, data privacy laws. It's the same in every country to make sure that we're protecting research participants. So ethics is for an anonymous survey. You get an exemption, but still every word, every image, every picture that is included in advertising a survey has to be reviewed and get an exemption or get an approval. If you're asking somebody their name and see their face, that is having ethics approval. You cannot change anything without going back and submitting it to ethics.
That's really important because I can't think of anything else in the work that I'm doing that requires that level of oversight and approval, right? That literally means I cannot change aspects of it without going back to that board, right? I think that's something that can be foreign for a lot of us if we're new to the space. So I
Right.
appreciate you explaining that. I know there's more. We'll talk about where people can find more information, and in fact, more information from you on a later slide. But I think that's something that if it's hard to wrap your brain around the ethics portion of it, that podcast can be very helpful. While we're on the slide, do you mind indulging me? I love a practical example. Um, I have seen in newsletters that we will say, can you please share this recruitment information with your community? Or let's say a call goes out because we're interested in people from a specific country. If I'm a member organization and I receive that, and I'm thinking, what do I do with this? Can we talk about ways that we can encourage people to go forward and help us to recruit so uh, the people in their community can be represented in research?
Yeah, absolutely. So you can share the information in your language. Most cases, we translate all those communications that we post either on our webpage or on our social media platforms. You have to use the same pictures, the same images that are used that are in the protocol that has attained exemption, but you can translate the words. It's the same words, but you cannot
I
make
see.
other changes to that. That's the whole aspect of getting an exemption, is making sure that you're not making any changes without informing ethics. If you see something that isn't right, that in your community you cannot say, that's fine. Just come back to us. We will update the protocol to make sure that everything is consistent. But the whole idea is that if you see us post something in English and you think that you can recruit for that, please either share our English post translated, but communicate it. I don't know if I'm being clear enough, but the whole idea is that we are asking you, if it's in your country, please help us recruit.
I think you are being clear, and I think that's nice to know. Oh, I don't have to send it down in English and be out of touch, or no one in my country speaks English. I can translate that, or they can take, say, a social media post of ours and forward it, and post it with an intro in their language. Is that correct?
Yeah, that is correct. Sometimes you'll get an email that we're recruiting in your country. Could you please share that? Because we share in English, we share in the United States, but or in countries that speak English. But the whole idea is that we want people to help us recruit, and that's what we do.
Yeah, that's a great benefit. Okay, so let's think. If we start with social media, that's one of the best ways for recruiting, for reaching patients or impacted individuals and their families, because oftentimes we'll have opportunities for caregivers or family members too, right?
Mhm.
So if we're looking for those individuals, we often will find them on platforms like Facebook, on Twitter. Those seem to be better for finding the families and impacted individuals. And then platforms like LinkedIn can be helpful in finding uh, healthcare professionals. If
Yeah,
we're
yeah, and some organization communicate by WhatsApp, for example, and
true.
on social platforms. So if you see that we're recruiting, this is not for survey, but for clinical trials in a certain
Hmm.
country, there is approved text that you can use in your country to use your platform. So that's the whole idea, is sharing that information, not changing the world. So 18 and above, parents of a child with this condition or something like that, but use this language, but promote it in a way that your community reacts to or sees, because they don't read the GAAPP newsletter. You do,
Right. Good
right?
point. That's a really good point. So as long as it's the same language, they can then push it out via their social media. If they think of a different way, so say they think, oh my goodness, I can tell my clinician about this, and my clinician could then maybe recruit or post a postcard in their office or something. Can they do that, or do they need to tell us that they'd like to do that?
It depends on the study. So I think that is where research at GAAPP.org is important, because we could say, yes, you can do that, or no, you can't do that. Or let's say if they think that that we're doing something that could be interesting in their country, then that's where the research at GAAPP.org, this is the place to ask questions.
That's
Sometimes
perfect.
you can, sometimes you cannot.
Got it. So the ways that the most often though that people will use will be their social media and their newsletters. That is just a great way to get to people.
Yeah, that's the way we normally recruit.
I think that's very helpful.
Yeah.
And again, you do not have to be a huge organization because sometimes we're looking just for two people or one person in a country. So if you are in contact with five patients, it could be one of your patients or both of them could be from
Yeah.
your group. Yep.
Yeah, for an advisory board, we do a lot of that. For patient investigators, we do a lot of that. So we don't need a lot of people, but sometimes it's difficult to find people, especially people with a rare condition or a condition, for example, that's not controlled, or that there's some inclusion criteria. There's some reasons why we're looking with people who have special needs. So, or if you're taking a certain medicine, we're looking to get some information from you. So we don't need a lot of people. We need help finding them.
This will inspire more people to be involved in that part of the process.
Yes.
Okay, so we have talked a lot about the MOs being our partners in research. Can you tell us a little bit more about the patients or their family members as being partners in research, what that looks like and how they can learn more?
Yeah, and they could be patient or caregiver representatives on an advisory board. That's a group that gets together either by Zoom or another platform or in person to talk about a clinical trial design or a new medicine or a new device. So they can be a patient representative and think
Mhm.
about, how can I represent my community? They can make the work more patient-centered. So it is important. Nothing about us without us is really important. They could actually make sure that the research is patient-centered, that it measures and asks the questions that patients care about, or caregivers to children or family members care about. They can evaluate studies, they can evaluate content that is a part of the research project, and that is a way to participate. So reading through things and saying, this is not clear. I've just had a review of something that I didn't think about, but it's just a word that doesn't make sense to people in lay terms, but it makes sense to me. So it's really important to have that patient perspective and making sure that this is real. This is the real world. This is how you or your loved one experiences the disease.
And I think I can speak for myself, and I think for you that we have both served on these types of advisory boards. I find it extremely rewarding to do this because it's an opportunity for me to share our experiences in a way that I had never had before I joined these
Yeah.
top types of opportunities.
Yeah, and as a nurse, I could say, so as a provider, I
Mhm.
saw some perspectives, but when I became a caregiver or a patient myself, I realized that there are a lot of things that we don't think about. And I think that is where it's really important to make this very a partnership in research, because sometimes until you experience something, you don't even think about it.
True. It's very true. How about Bridge? Let's hear about Bridge from the COPD Foundation. This is really exciting work.
So COPD Foundation is a fantastic organization, really, really good at research. And the Bridge Project was aiming to increase patient caregiver voice in research. So we are providing the link because they have fantastic content that was developed in partnership with patients to see how patients could be a part of a trial or a research project. So being a patient investigator, is not just representing yourself, it's representing the community of patients. So understanding the difference between saying, this is my experience, this is what I live with, is one way you can contribute. But to be a patient investigator, you have to think about, how are other people like me with my condition experiencing the condition? How would they react to a certain research project? So we really encourage people to look through this material and participate in these efforts of the COPD Foundation Bridge Project, because I think it's excellent training on how to be a part of a trial, of a research project.
I love that. Tell us more about the role of the patient communities in research in general.
So as the world evolved, like I said, when I started working in research, it was pretty much the experts. We sometimes brought a few patients into advisory boards, but in most cases, it was what we thought from our observations as providers, what patients needed and what patients wanted. Now, patient groups are becoming more and more part of any clinical development or any research project, because they truly understand their unmet medical needs. And that's the quote on the left. The other thing that's important is contributing your data to research registries. So there are a number of research registries around the world. There are specific examples here, but this is just in the United States, but there are examples around the world of patient groups that are participating in research registries. What it is that you don't have to participate in a clinical trial, but you're willing to lend your record to research. And so you're not named necessarily. It's just a registry that you contribute your data to. There is a protocol, all the steps that I mentioned around what it takes to do research, but patient groups are now organizing those registries. The most famous one is the Cystic Fibrosis Community. Without the Cystic Fibrosis Foundation and what they've done, that disease would not have been transformed the way it is today. It's a rare condition, but without a patient advocacy group or a patient group, nothing would have happened. And today we see so many medicines for people with cystic fibrosis. That is because a patient advocacy group got involved.
Love that. I love hearing that. It shows the power of all of us together.
Yes, everybody shares around the world. And I think that image is the whole idea around
Mhm.
it, is that diversity is important and participating in global registries is critical. So in some countries, it's more organized, in other countries, not so much. But the whole idea is that the more diversity we have, the better treatments we're going to develop.
And these two, I think it's important to note, also are under ethics oversight.
Always.
Yeah.
Yes.
So that's helpful in thinking that through. And how about this one, Ruth? Tell us more about this.
So patients could get involved in research very, very early on, should get involved
Mhm.
very early on. I mentioned the surveys, understanding what the problem is, but when it gets to a clinical trial or a study, patient investigators can help develop the research question, making sure, I mentioned the patient-reported outcomes, making sure that in addition to measuring lung function or skin redness or something that's an objective outcome, we also know how people feel. So making sure that what is measured in the study is important to patients and caregivers as well. They can help say these patients should be included in the trial. So as scientists, we define what are the entry criteria for the study, what to address the question. But sometimes a lot of people feel that they get excluded from a study because, let's say, they don't want to stop taking the medicine that they're taking already. So being a part of that conversation is, who can we allow in the study and still ask the research question? How can we help people really be a part of the study? Are the study materials clear? Do the patients understand why the study is being done is really important. And also, as I mentioned before, recruiting for the study, participating in the study and in the data collection or the analysis of the results, reading something, and all of a sudden you see a result that maybe looks like a minor thing, but for the patient or a caregiver, it's really important. So contributing to publications, even if it's scientific publication for researchers, scientists, or clinicians, saying from a patient perspective, this point is actually really important. So patients can contribute at every stage of development of a project.
And one of the things I want to stress, because this part is particularly exciting to me too, both as a patient and a past researcher, we are going to be in the spring or late winter hosting a webinar actually on patients being research partners. So now we're sort of speaking to our MOs, we'll then be speaking to patients so that our MOs can then share that webinar with patients and don't have to do that themselves. So I think that should be really empowering for people. And we'll be sharing information along these lines and expanding on that in that webinar too, because I don't think many people know the extent to which that they can participate, right? I can do this, I
Yeah.
can do much more if I'd like to, and all of it being helpful.
And would that be translated or would it be in English only?
It'll be in English, but we can translate for sure.
It would be amazing.
Yeah, I'd like to see it get to as many people as possible. So we're going to talk about additional resources. We've been referencing this podcast. I know there is more than one. Excuse me, Ruth. It's just not available right now. Is that correct? So this first one is out.
Yeah, the first one is out. The other one is supposed to be coming out. The first one is just explaining what clinical research is, and what are the rules and regulations around doing clinical research. Some of the information we shared here, but there's a lot more in there. And the second one is very practical about how can you as an individual or as a patient or a member organization contribute to research. So these are the two. And then there's one on artificial intelligence, and we'll be adding more and more to that. So this is Passion for Patients project that's led by our president, Tanya Winders.
They're fantastic. And I had the pleasure of overhearing Ruth's recording while it was being recorded. And I think everyone will find it helpful, no matter their level of involvement or familiarity with research. And we also have similarly several different GAAPP academies about things like engaging in clinical trials. Obviously, we have this GAAPP Academy. So check out those as well. The Bridge project is included here, which he referenced before, but I wanted you to see the entire URL here again if you're interested. But if you put into Google or another search engine, Bridge Project COPD Foundation, you will be able to find it because that's quite a long URL. And Ruth mentioned this clinical trials education booklet before. This is a booklet that it was intended for people with COPD, but I think there are great learnings for anyone who is interested in learning more about research as from a patient perspective. What does engaging in a clinical trial look like? Do I need to engage in a clinical trial or participate, or is it voluntary? How do I find out about a clinical trial? So this could be very helpful to you in your interactions with your community. Okay, so let's get started on the Q&A. I want to make sure that we answer some of these beautiful questions that you sent in. Again, we've received dozens of these. I'm so impressed with everybody taking the time to submit. And I just want to keep this up for one more second. It is the best way to contact the research group at research@gaapp.org. So feel free then to reach out to the research group. I'm going to stop my share here. Fantastic. Okay, so let's get started. I love this question. I know you did too. How do we balance academic research with the practical priorities of our NGOs or our patient advocacy group?
That's a great question. And yeah, you're right. This is near and dear to our hearts because that's why patients need to get involved in all stages of research from the beginning. That is the whole aspect of patient-centered research, is that we make sure that we ask questions that are important to patients, and patients help prioritize what's important to them. So that is absolutely what our mission and vision are, is to bring the patient voice into everything that is done in research. And sometimes academics want to do things that's important because that's where innovation comes from. Sometimes we don't think of things, but to have patients help us prioritize what's important when we set our objectives for research is important.
Love it. And NGOs can help to set those priorities too in their
Yes.
conversations with people who are doing research, right? Patients and the NGOs themselves. Look, this is what's important to us right now. So this is what we are able to do, right? This is how we're able to support you in research that help researchers to design what they're doing.
Yeah, and maybe something that I don't know if we'll talk about submitting research proposals, and I know the impact funding the GAAPP has. It's really important to think about, how do you, before you submit the proposal, what is your biggest priority? What is your biggest ask? Because sometimes you have a lot of objectives for research, and it's great to say, this is my big picture, this is what I would like to do, but this is where I would start. Here's my pilot study, and then I would do all the other stuff. So I think it would help you also when submitting proposals to think about, what is the research question? What is most important in my community that we find out?
So let's talk about that and the impact grant process. But I think it's important to note that you are not asking people to pick a favorite child. It's not along those lines. It's someplace to start, right? And what's most important to your community right now, if that's something that can fit in with your strategic planning, and what you're able to, frankly, what you're able to support from not just a financial perspective, but from a recruitment perspective and a resources, internal resources perspective, person power, et cetera.
Yes, exactly.
Okay, I think that's helpful. So let's talk about that process for submitting the proposals and the research ideas. That's the same process then? If I have a research idea, I can submit for an impact grant. It doesn't have
Yes.
to be awareness or education or
That's
no.
correct. Yeah,
Okay.
I think the condition, and I'm not directly involved in that, but the condition is that you have to have something that has funding from other
Mhm.
sources to ensure that you can succeed, because research is expensive. GAAPP has limited, as a nonprofit, has limited resources, but the whole idea is to say, here's something special, simple and very special to my community that could be impactful, and this is what I need. And these are the other funders that would be involved in the project. That's my understanding of the
Mhm.
impact. Another possibility is, when you're about to submit a grant to another funding source, is to say, would you like to join? Could you join with us? And that's the research at gaap.org. Obviously, we have our own objectives for each year, so we can't take on a lot of projects, but sometimes there's a European grant, there's a South African grant proposal, or in the country. And the whole idea is that we can be partners in that and help you develop the submission and the protocol and the proposal to get funding from other sources. So yeah, our resources are limited, but we can help you say, this is, how do we start small, show that we can do really well, and then we ask for more money. So that's my biggest advice to young researchers and people who are starting out, is think small, show that you can do it, and then ask for more.
I love that idea, demonstrating your abilities and your impact, and then building upon that foundation. Let me ask you, as if I were an organization that had never submitted a proposal specifically for research before, how much time should I leave for engaging GAAPP as a partner, or for asking GAAPP to review and that type of thing? Is this something we do in a week or two, or is it more like a month, 6 weeks, 2 months? What kind of window?
It depends on the project, but because there's so few of us, the whole idea is that we
Okay.
try to get back to you as quickly as possible. But the thing is that you need to be very clear about why you're doing something. So if there's something published, for example, on the prevalence of urticaria in a certain country or in a certain region, or COPD, why is it that you think this research is important? What question are you going to be asking? And we can help you with how. right? How do I do it? How do I write the protocol? All that. That is the piece that we can help you with. But what we can't do for you is tell you what's important to your organization and to your community, because we don't know. So sometimes we will come to you and we're saying we're doing something in Saudi Arabia or in the United Arab Emirates or wherever it is that we do, we come to you and we say, we're doing something in your country, can you help us? Turning it around, you can come to us and we say, we feel that we need to understand what symptoms people have or what problems are people having with biomass or with cooking equipment or with pollution. So you come to us with why is it that you want to do the study and what is your question? And then we can help you develop the proposal. Does that make sense?
It will probably be one of the most helpful things people take away from this entire presentation, truthfully, that's the morsel. Okay, do that legwork and talk to your people and read and listen, and then come to us and we can say, we can help you to figure out how to put this into place. Truly, I think that will be one of the biggest takeaways. I want to fit in a couple more questions because we just have a few more minutes. One of the biggest things I think that is important, no matter where we are living in the world, and I'm very happy there's a spotlight on it right now. You spoke to it before, is diversity. How do we ensure the inclusion of diverse populations, particularly underrepresented populations, in research, whether we're GAAPP or an MO? How do we do that?
It's really important. So the first thing to think about is health literacy and access. So not everybody has access to the internet. Sometimes you need to do something by paper. Not everybody can read. You need to do pictograms. So it's really important to think about in your community, what is the best way to communicate with patients and caregivers? So translations we mentioned before, but literacy, making sure that someone with sixth grade level, I mean, depending on what it is, reading level can understand the question is important because obviously some of us have doctorates and are very highly educated, and a lot of our patients are, they understand that, but there are a lot of people who cannot read well or don't necessarily have higher education, and they need to be communicated to in a way that is meaningful to them. And that is where diversity is important, because otherwise we're only bringing one aspect of society, or one aspect of the patient community, which is the educated patients or those who live in certain countries or see the expert doctors. So I don't know if I answered your question, but to me, pictograms, translations, paper rather than internet, doing interviews, going to communities in some countries is really important.
Agree with it 100%. And I think when you think that you have simplified language, let's say, or imagery enough, I always encourage people to take it one more level because, again, remember, you're the person writing it. So it's just important you have this background that someone else doesn't, whether it be in the condition or in research but just make sure you're paying attention to that and not assuming because that can be, I think, harmful to the work that we're doing. Um, in closing, I'm just going to sneak these in. Tell me, are there research areas that GAP considers priorities right now? And another question that's related to that is how do you see future collaborations between GAP and member organizations in the field of research?
That's a great question. And obviously, we don't have a lot of time, but I'm happy to say that Kristen convinced us in January to come back and talk about, with Tanya, talk about our objectives for 2025. So in January, we're going to be recording a webinar. We shared our objectives at the summit, but we'll be doing an academy to talk about the objectives and how member organizations can help us in 2025.
Perfect selling of that. Thank you, Ruth, for that pitch. I hope everyone will join us, but truly, I just think this has been such a rich hour of conversation. Ruth, I want to thank you. I want to thank our member organizations for being here because this is work that we could not do without you. And please, if you have any questions, please feel free to follow up. If it's with research at gaap.org. General questions can come to info@gaap.org. And we'll see you on the next GAP Academy. I wish you a wonderful day. Thanks again, Ruth.
Thank you.